Hello, everyone. Welcome back. Episode 8, Isekai Yakkyoku. This one's actually pretty interesting because now we've got kind of both sides of pharmacy in terms of both the hard science and also the soft skills that you need to survive as a pharmacist. So we'll have a look at those today. We're starting off with a bit of a doozy here with the previous episode's pharmacist in the preview. His daughter has contracted some sort of illness, and he comes to Farmer for help, even though his guild is not particularly happy that Farmer is moving in on their turf, so to speak. So right now I have the episode set to just before Farmer starts taking the patient's history from the father, and we'll see where we go from there.
では、いくつかよろしいですか？娘さんのお名前と年齢は？
マリー7歳です。
Name and age always important,
最後に
especially with a
食事を
child.
取られたのはいつですか？
昨日の昼くらいかと。
かなり熱がありますね。脱水もありそうです。
I'll let her go
少し朦朧
through
としていますね。
the full history, and then we'll talk about it.
たった一人の患者のためにこんなに丁寧に調べるのか。
マリーさんの体重ってわかります？
いや。
じゃあ、ちょっと測ってみましょう。
Okay, so basically he went through, name, age. What else did he say? Let's go back a little bit just to make sure.
いくつかよろしいですか？娘さんのお名前と年齢は？最後
Name, age. Yeah, name, age, last time she
に
ate.
食事を取られたのはいつですか？かなり熱があり
And then he started talking about symptoms and stuff like that. So, generally, this isn't the way I would take history. It seems very direct. It's not giving the patient a lot of opportunity to actually talk about, their own experiences about the symptoms and what they're experiencing. And by not doing that, you're actually kind of cutting off the patient from giving a lot of useful information. And also some of the questions I think are a little bit whack. So name and age are obviously very important, making sure you know who this person is so that when you do supply the medication, you get the right person. Age is important for, dosing reasons to make sure they're a child, that kind of thing. After this, I would go into, does she have any other medications? Does she have any other medical conditions? Does she have any allergies? That kind of thing. So those are kind of establishing previous, simple, very easy questions and establishing previous history with the patient to make sure that, you've got her basic kind of medical details down. At that point, I would then be like, okay, so, what are her signs and symptoms? Why are you worried? What's causing you to come see me today? And how long has this been going on for? The question about how long has it been since she last ate is very pointed. I don't think it's a very useful question if you don't know what you're already dealing with. So that's not really what I would open up with, but it would be something that I would ask later on down the track if it became relevant, essentially. But for something like this, where it's likely it's a flu or a cold or something like that, medications, any other medications, any other allergies, any other history like asthma, that kind of thing that I need to know about. And then what are signs and symptoms? What have you done about it already? Because more often than not, the patient's father in this case, because she's a child, they'll most likely have already done something. They'll probably be like, oh, I tried to make sure they stayed in bed and gave her plenty of fluids, that kind of thing. Didn't seem to do anything. Or, carried her around the city for a little while and proclaimed that she was, had an evil spirit in her, as the case may be in this particular instance. So this particular method of history taking is a little bit off-putting, I think. Farmer then goes into what symptoms he's noticed. That I would hold off on that usually and ask the patient or the patient's father, in this case, what symptoms they've already noticed themselves, because they're more likely to give you a full list if you don't prompt them for it. And frankly, if you do prompt them for it, more likely than not, they will just tunnel vision on those particular symptoms and not give you kind of their full picture. So it's usually better to open your history taking with open-ended questions and then narrow it down as you get further into what you think the diagnosis is, right? So in the case of influenza cold, you might start with symptoms, signs, stuff like that. And then as you get towards influenza cold, you might be like, when was the last time she ate? What kind of fever has she been recording? Has she been drinking very much? Has she been anywhere? Which obviously came into more of a focus during the past couple years. Where did she go? What symptoms has she had? Have you reported this to, contact tracing people, that kind of thing. So the opening simply with when was the last time she ate, not the best idea. The whole weighing thing does actually happen quite often in pharmacy, especially with infants, because mothers generally will know their child's weight, but fathers will not, unless the father is super involved in the patient's care, which sometimes they are, sometimes they're not. But nowadays, sometimes usually it'll happen in the doctor's office when it gets prescribed, because the doctor needs to know what dose to prescribe the patient, so they'll weigh the child while they're there. But sometimes it still happens in pharmacy if some time has passed and the doctor has given maybe a prescription for future infections, that kind of thing. So I'm very interested in what he's going to prescribe. I think he's right. Or like the symptoms will point towards, a flu or a cold. And I'm assuming it's flu because the name of the episode is Dawn of Flu or whatever. So I'm pretty sure it's flu. There's not really any medications, particularly for flu, if the symptoms have lasted for over 48 hours. So the current antivirals that I know of for influenza treatment are oseltamivir, which is marketed as Tamiflu, and the other one is Rilenza, I think is the brand name, but the drug name escapes me. But essentially, they're both kind of around the same type of drug, same class of drug, and neuraminidase inhibitors. And generally, they're only really useful within 48 hours of symptom onset or, prevention of influenza if, you come into known contact with an influenza patient or something like that. So I don't know if he's going to prescribe that. Honestly, in this case, I'd probably be like paracetamol and plenty of bed rest, and she should get up. The fact that she has a fever is good. Fever means that her body is fighting the flu virus. So, the fact that she has a fever is pretty good. Of course, if it gets too high, then she might need to get hospitalized, that kind of thing. But considering there's medieval times, I don't think they have the capability of dealing with it. So otherwise, plenty of fluids, plenty of bed rest, probably some soft drink, just because kids like soft drink, and it's a way of getting them to ingest some sugar and some electrolytes while making it fun, right? So some kids will like that. And then usually like some porridge or something like that if they don't feel like they can keep anything down. And they should get better, within a few days. Kids bounce back pretty quickly. But we'll see what happens. So I think they'll go get her weight. Yeah, so he's taking her
体
weight.
重を測ってます。後でピエールさんだけ測って差分を出しますね。
はあ。
体重を測るのは薬の量を決めるためです。
And yeah, so measuring the weight to determine the dosage. Usually, obviously, pharmacies these days don't necessarily need to do that. The doctor does. But as I said, sometimes it still happens in pharmacy.
適切な量でないと薬が効かなかったり副作用が出たりしてしまいますので。
Yes, very obvious.
俺たち平民の薬師は子供の
Now he's doing basically what a doctor does in terms of examining the patient's physical condition, like examining the mouth and the rest of it. pharmacists don't necessarily get that opportunity to do that. I mean, it's not like we can't. We can always ask someone to open their mouth, but we obviously don't have those kind of specialist tools on hand necessarily to be able to perform those. Because, we don't usually have torches on hand.
薬といえば一律に大人の半分と大雑把に処方するのが普通なのに。
はい、ありがとう。最後に。よし、脳症はなさそうだな。
それは真術ですか？
まあそうです。マリーさんの病気が分かりましたよ。
Yeah, of course you did, because you just pointed your fucking eye at him, bro. Far out. This guy, his eye is so useful, dude.
重い風邪のようなものですね。
は？そんな、
Severe
これが
cold,
風
yeah,
邪？
influenza.
ええ。
こんなに高熱があって口から泡吹いたり痙攣したりしてるんですよ。
Yeah, so symptoms of like an influenza infection. That's pretty bad. Foaming at the mouth, convulsions. Yeah,
これがただの風邪だなんて悪霊か何かついているのでは？
of course nowadays it doesn't tend to get that bad because we have better ways of protecting ourselves. We have better protection in general because we've had multiple generations of people to be able to build up immunity to influenza. So but in olden days there are accounts of influenza being pretty horrendous.
いいえ、マリーさんは重い風邪、いわゆるインフルエンザです。
Yeah, great.
何ですか？
What is influenza?
マリーさんは今重い風邪を引き起こすウイルスに体を侵されているんです。
ウイルス？
この薬、正式名称はザナミビルと言いますが、娘さんは
Yeah, Zanamivir is Relenza, I'm pretty sure. So, this guy knows so many molecular. I don't understand how he knows this many molecular formulas when his one specialty was on his little sister, which presumably was some form of brain, like tumor or cancer or something like that. So, if he's researching specifically that particular disease, I don't understand why he remembers all of these molecular formulas, unless he's just like a savant genius, because no one really remembers that. We'll go through the rest of his explanation. I'm curious to see how technical he gets with it. Because, counseling a patient on how to take a medication and what the medication is so that they're not scared about it and they can effectively relay that information to other medical professionals if the need arises is also an important part of a pharmacist's job, making sure that, the person knows, what they're taking, what it's for, and when to stop taking it, or, when to go get more help should they need it. So we'll see what he says.
発症後まだ1日なので、この粉薬を口から吸入させます。
吸入？口から吸い込むんですか？
この薬は飲んでも体内にうまく吸収されません。吸入することで病原体が増えている気道に直接薬を届けることができるのです。詳しく言うと、まあ、マリーさんの体内で起こっている戦争を手助けするための薬です。後で吸入の練習をしましょうね。
Oh, it even says how to practice it. Yeah, so Relenza is oral inhalation. So that means breathing in through the mouth, mostly because at least practically speaking, I don't know if there's an actual pharmacological reason behind it, but when it comes to practically inhaling through your nose, more than likely the powder will get stuck in kind of your natural filter, which is your nose hair. Or you'll sneeze or something like that because you're not used to taking in foreign matter through your nose. It's a lot easier to orally inhale it because if you can focus on it, usually you can keep that flow of air going into your lungs without too much trouble. So his explanation, his counseling was getting on the verge of being too technical for her. Personally, I don't think this helps the kid at all. I would just be talking to the father at this point, saying, she needs to breathe this in. This helped her fight off the virus in her lungs, because that is where, the bad thing is, right? And especially with a medieval setting, obviously my counseling would probably be inadequate because I'd have to say, you know, this isn't a bad spirit, etc., etc. But for modern day terms, that'll probably be the best way of putting it. He did say that it is best from symptoms within 48 hours of symptom onset. So yeah, that's true. And he does also mention that he'll help her practice taking the medication, which is very important. There is, especially for like asthma and things like that, if you're talking about specific medication devices such as inhalers, some of them do get really kind of confusing, especially for kids or elderly people. So if you're talking about asthma, for example, there are, you know, your standard Ventolin puffers, which is just, you know, you press on the top of the inhaler and you breathe in at pretty much the same time. That's how you take Ventolin, right? But then there are AccuHalers, right? Which is where like you have to, it's like a disc pretty much, and you have to crush the pod inside the AccuHaler, and then you need to take a long, deep breath for it to actually get and deposit in your lungs because it's the actual powder inside, right? And it's not a forceful actuation into your mouth. What else is there? For COPD, for chronic obstructive pulmonary disease, which happens mostly in older people, you'd be looking at Spiriva, and the Spiriva devices come in two different forms. One of them is like a mist, so then the person doesn't actually need to expend that much force once you've primed it. But then there is also the other device, which is a lot more complicated, and I kind of have to. It's not complicated. It takes a lot more force because you are crushing the pod inside the device. It sort of is. I'm pretty sure it is an AccuHaler off the top of my head, but it's been a long time since I've counseled on Spiriva. Sorry, so I might be remembering wrongly. So yes, counseling patients on how to take medications is also very important. Making sure they're taking it the right way and they're taking the right dosage as well, especially for children, because you don't want to end up, you know, prescribing too much and ending up, you know, killing all of their gut bacteria, for example. It's an antibiotic. So all in all, I think his counseling is pretty okay. I don't think the kid needed to be there for all of it because it's probably gone straight over her head. But at least telling her that it will help her and that she should try her best to take the medication and to remember it if daddy doesn't. That's always, you know, a good idea. To make sure that you give the kid some responsibility over their own health as well.
戦争ですか。
ええ、マリーさんの体は熱を出すことでこの病原体を退治しようと懸命に戦っています。こういった病原体は熱に弱いですから。なので熱が出るのは悪いことではありません。ただ、同時に体力も消耗しますので、少しだけ熱を下げる薬、アセトアミノフェンもお出しします。
Acetaminophen. I always find it really interesting that because Japan, of the history of Japan,
少し落ち着いて飲めそうでしたら水分を取らせてください。私も後で見に来ます。
Cool. So she looks a lot happier now. I suppose that because of modern medicine, or technically the setting they're in, the medication will work a lot more quickly because, you know, the particular viruses here don't have any exposure to modern medication. So that's probably why it works so quickly. To be fair, the Panadol would probably remove most of the outward symptoms and would make her feel a lot better. So that's probably why. But, you know, that's all that there is on that one. So he manages to diagnose her correctly and prescribe the correct medication. I don't know about the antiviral, to be honest. I can't remember how long it's been since she had the influenza, but I don't think it was really necessary. I think the paracetamol, bed rest, and, you know, some fluids would probably do her just fine. But, you know, that's his decision to make as a physician / pharmacist in this case. And, you know, it's not technically wrong. It's just, you know, a personal preference. Considering he has that ability. If a doctor prescribed it, then, you know, in the real world, if a doctor prescribed it, then I don't really have much of a choice if the patient comes in and asks for it. As it would still be, you know, fairly appropriate in my case. But I would probably say, maybe it's not needed if you think they'll get better with just, some fever relief and food and the rest of it. But, that's all the recommendations really that I can make. So we'll move on quickly from here. Just give me a sec. Alrighty, one last thing before I go. So in between his daughter being treated for influenza and this particular scene, he's gone back to the Commoners Guild of Pharmacists and been like, hey, we should talk to this guy because obviously he has better knowledge than us. And the guild has been like, no, politics, you suck. Even if his knowledge may be great, as soon as he disappears with his divine art and whatever, the medical infrastructure will simply disappear at that point if we just give in to him. And, I don't think that's necessarily correct. That's getting into a whole different kettle of fish of politics. And in this particular series, it has been quite interesting. There is a little bit of a parallel that you can kind of draw with, pharmaceutical companies and the rest of it, who has the money, the capital, essentially, to be able to invest in new therapies and things like that. And the ethics behind that as well. And that's a whole separate discussion that I'm sure you can research yourselves and come to a conclusion about yourselves. I'm not going to get into it here. But if you want to, check down in the comments and see and provide your point of view, I'd be happy to, give a healthy debate about that. As long as it is, of course, civil and within guidelines, all the rest of it. Anyway, so here, Farmer's given this guy a second lease on life. He said, hey, join my, crazy guild. We have modern medicine and blackjack and all the rest of it. So now he's opened his own pharmacy under Farmer's auspices. And this goes into a little bit of what I think the mission statement of pharmacists are. And it's a little bit of what they instilled in us in pharmacy school in terms of our profession and what we should be proud of providing a service for the community. So we'll see what he says first, and then I'll give a little bit of my own modern pharmacist perspective on this kind of thing.
栄養補助ウェハースよし準備すべてよしでも俺でいいのだろうかお客は来てくれるだろうか異世界薬局ではないファルマ様ではない店主のこの店に
トト様頑張って
So Japanese, so typically Japanese for the kid to just say, you can do it, Dad! Anyway, sorry.
胸を張れ俺はれっきとした薬師なんださあ真相回転だ
異世界薬局との提携1号店ですって同じ薬が買えるそうよ
俺の店新しい世界一の薬を取り扱える店の始まりだ
Very good. All right. So this guy's obviously pretty happy that his shop hasn't gone under. In terms of kind of pharmacist mission goal, that kind of thing, we're obviously here to make sure that the public, general public, or whoever's sick, whatever, and uses medicines well. We're here to ensure the quality use of medicines is, one of the buzzwords, not even a buzzword, one of the phrases that was used quite often in pharmacy school is that we're here to ensure quality use of medicines. And what that means is that they use them safely and they use them efficaciously and they use them properly, essentially, to make sure that we get the best outcomes out of the medication and, nothing more. So this kind of strikes a little bit of a chord, I would think, for most pharmacists, in that we all try to strive for patient health and patient safety. And it's something that can often get lost in amongst all the other stuff that comes with running a pharmacy, all your stock, all your, difficult patients that, maybe don't take your advice properly, all of the people that might take you for granted because you provide these kind of health services kind of for free because you run a retail shop, for instance. So all of the other kind of accoutrement that comes with running a pharmacy, being a pharmacist, sometimes it is important to ground yourself and make sure that you remember, the reason why you became a pharmacist. Obviously there's some instances, especially nowadays, where people aren't as inspired by their work, for example. And that's true to some extent. But in these kinds of professions, when it's healthcare or really whatever you're doing, sometimes it is important to make sure that you kind of ground yourself on, why you chose this particular profession, even if, like, at the end of the day, you're kind of only doing it necessarily, because you need to earn a living. It is important to be able to take pride in the fact that, you may earn your living through providing quality healthcare to people that need it. Or that you provide quality healthcare to, your community, to sick patients, and that you're able, through your own knowledge and your own capabilities, to be able to provide those services. And you're recognized by the community for that through, not only, monetary means, for example, receiving money for the services or goods rendered, but also by being a trusted member of the community, to be able to render those kind of medical decisions and be able to supply or dispense, those particular medications. So I think that's just one thing that, needs to be reiterated from time to time. Certainly in my fairly short, I would say, compared to other people, fairly short stint, well, career is the proper way of saying it rather than stint. In my short career as a pharmacist and beyond that in clinical research, it is good to sometimes come back to that, especially during, like, COVID, for example. It became very obvious how not essential, but how important pharmacists are in the healthcare system to be able to prevent and also necessarily reduce some of the strain on the doctors and hospitals and things like that, to be able to deal with the more important, well, not necessarily important, but more severe illnesses and things like that require, greater medical care than necessarily a retail pharmacist. So yeah, I think that particular episode was pretty good. It definitely delved a little bit more into, the politics of pharmacy, that kind of thing, and had a little bit of hard science behind it. And I think the idea of, this pharmacist or pharmaceutist, sorry, using the proper term for this particular fictional series, that this pharmaceutist recognized that his own business was, not serving the community's best interest, and renewing his own kind of dedication to the mission statement of quality use of medications, I think is pretty interesting. And sometimes even today, we all need that kind of reawakening, I suppose, or reaffirmment of our own kind of dedication to, why we became a pharmacist in the first place, even if it was just a profession that we thought we'd be good at to make some money from. So yeah, I think that's probably going to end it for this week. I hope you enjoyed it, and as always, I have the previous episodes already up. Hopefully I should have some other content coming out soon that's actually just about anime, rather than necessarily my moonlighting as a pharmacist. But we'll get to that at some point by the time this anime is over, I would imagine. So yeah, hope you enjoyed it. Like and subscribe, obviously, if you enjoyed this and if you like the other episodes. And yeah, chuck me a comment if you have any questions about anything about related to pharmacy, or some of the things that I've said during this episode. So yeah, I'll see you again next time.